Welcome and thank you for joining us today for the 11th installment of Motionsoft's 8-week Technology Summit Education Series. Our session today is titled Personal Health Data, Understanding the Rapidly Evolving Use of Technology in Fitness, Health, and Wellness. Your presenter today is Jill Thorpe, partner of Manatt, Phelps, and Phillips, LLP, who we'll introduce in just a moment. My name is Todd Tweedy. I'm based in Motionsoft's corporate office in Rockville, Maryland. I'll be your moderator for the series. Just announced, we are now officially winding towards our 2016 Motionsoft Technology Summit that will be held in Washington, D.C. on September 13th through 15th. A link to take advantage of the early bird registration discount will be sent to summit attendees so that you can get on the calendar and attend the 2016 summit. Very excited. The Summit Webinar Education Series has been designed to support your professional development by giving you access to industry-leading thinkers and companies that are driving innovation in the fitness industry. We're down to one final session in the series that will focus more on digital partnerships and specifically how to partner with Under Armour. That event will take place on Thursday, December 10th at 2 p.m. with Bill Besselman, VP of Integration and Digital Strategy with Under Armour Connected Fitness. You can view the complete webinar schedule by visiting the MotionsoftTechnologySummit.com website. I want to take this moment to keep you up to date on some activities taking place at Motionsoft and specifically our back office support services. As you may well be aware of, Motionsoft now provides 100% PCI certified full service billing solutions to complement our industry-leading expertise in enterprise and small business club management software applications. The Motionsoft full service solution actually leverages two best-in-breed resources. First, a dedicated in-house full service team and an automated rules-based back office support system platform. If you're interested in exploring full service billing or our standalone BOSS service, please contact your support representative by calling 1-800-829-4321 or by emailing support@motionsoft.net. Now, let's take a moment to ensure that everyone's familiar with the webinar control panel, and so you can pose your questions to our presenter today, Jill Thorpe. First, you should have a control panel on the right side of your screen, similar to the image that you're seeing here on this slide. If you don't, the control panel is likely in your taskbar. Just look for the orange clover icon and click it to open the control panel. You'll have the ability to submit questions during the webinar today using the questions feature located near the bottom of the control panel, which is highlighted in a red square in this presentation. If you could, please take a moment now and practice sending a question via the interface. Try typing hello or my Christmas shopping is done. And if you could, click the send button. Fantastic. I think everybody's got it. Thank you, Rob. Mine isn't started. Hey, I'm with you, brother. All right. Finally, I want to let you know that our Q&A session with your presenter will be held at the conclusion of the presentation. If we happen to run out of time and not able to address your questions during the webinar, our presenter will follow up with you directly. I'd like to remind you that this webinar is being recorded. Your microphones are muted, but you will have the ability to ask questions via the question interface we've just reviewed. After the webinar concludes, you'll be sent an email with a link to download the presentation, as well as this webinar recording. It's now my privilege to turn over this webinar to your presenter today, Jill Thorpe. Jill, welcome to the Motionsoft Technology Summit Education Series.
Thank you, Todd. It's a real pleasure to be here. And contrary to what Todd said, don't hold your questions until the very end. I'm going to give discretion to Todd to interrupt me at any time if there's a question that seems particularly apt and probably universal for those of you participating in this. First of all, let me introduce myself. Also, I participated at the summit in September and was delighted to be there. My focus at the time was concerning personal health information and the privacy and data security implications, and especially to the extent and if a health club operator were ever to share that information with what are known as covered entities, those entities which are usually healthcare payers or providers who are subject to the HIPAA laws to protect patient information, patient individually identifiable information. But in making those comments, it sort of presumed, well, why would a health club in the first instance share that kind of information? And I think when you consider the title of this presentation, understanding the rapidly evolving use of technology in fitness and health and wellness, you probably all recognize that there's just a massive convergence of forces that are taking place. And my goal here is not only to tell you about those forces, because there's a lot of noise in there, but maybe to help guide you through what could become a compelling mHealth strategy that you can devise that would not only help you acquire more members and retain them, but potentially also partner with those healthcare providers and deliver some meaningful results that are intensely valuable to healthcare providers as they move from an economic model that focuses on volume and treatment of illness to one that's focused on value and population health. And so I bring that perspective as a partner in the healthcare division at Manatt, Phelps Phillips, but also as a former operator in a startup that commercialized its own wearable wristwatch monitor and deployed it predominantly for healthcare providers and operators of senior living using a cloud-based remote monitoring platform. Also, a little bit about Manette is that we take a, I think, unusual view in serving our clients, and that we're not strictly a law firm, but also offer strategic consulting. As you all know, there have been gigantic shifts in healthcare landscape since the passage of health reform in 2010, and our consultants, who equal in number to the number of healthcare lawyers, have been at the forefront of policy development and then assessment of the implications of those policy developments on the businesses of our clients, who include healthcare providers and payers and government, state and national government agencies. We take a similar view in other areas where we are nationally ranked, including advertising, marketing, and media, and entertainment. Our firm was founded 50 years ago in Los Angeles, and we have one of the leading entertainment practices, especially in music. And we see also with the evolving changes in media that there are opportunities to bring content and those multiple media channels to the fore in healthcare. But the challenge is going to be how you do it. So I wanted to start with just a thought piece. I happen to know of a company, it's not a client of our firm, so it's a company that I'm intrigued by called Playlist. And actually, it's not to be confused with a playlist from the pre.com era. This particular company has a streaming music platform, and it also incorporates chat and an ability to share playlists. And so in my head, if I were a member of this platform, I'd want to be sharing my playlists with my social network. And then maybe also, if I were inclined to listen to those share lists while I'm exercising, I might want to incorporate my playlist with the create playlists specifically for the exercise I do, and even tie it back into some wearables that I might be using. And it could also be the fitness machines, for example, in your clubs. Now we're getting to something that's potentially interesting from the standpoint of where you, as health club operators, can deliver value and differentiate your brand. And that's by creating health challenges that are leveraging these existing modes of entertainment and engagement into helping your members achieve health goals by providing them incremental health challenges. And then and maybe the health challenges to come into the club a couple of times, complete a certain amount of classes, complete a certain amount of calories burned over some period of time, and when they do that, they can unlock their favorite playlists. Now, you can even take it a step further and start looking at some of the cachet of your coaches and instructors and celebrities. Some other some clubs have already been able to do this, to create sort of social media-driven celebrity among coaches. And now you can create challenges potentially where by completing those challenges, you can unlock the playlist of those coaches or other celebrities. And then finally, since my creativity kind of stops there with playlists, but there are so many other ways in which challenges can be devised that are leveraging the modes of engagement through mobile apps and social media today, is what if you then were able to bring into your health club a B2B platform, which is highly configurable, and that can allow you to create an entire mobile app strategy that is inspiring health challenges, inspiring people to greater activity, and all the while gathering personal health data from the trackers that may be used within and without outside of the four walls of your establishment. And why is that interesting? I mean, that from the standpoint of your staff, who may be fitness trainers or personal trainers or coaches, may have any number of different certifications, they would be able to access that information with the member's permission to gauge their progress toward member goals, and then use that information as a point of engagement with the individual to spur them on to more activity and towards achievement of their goals. Think in terms also of not just counting steps as a metric to success, but really you're wanting to affect the overall health and well-being of your members and helping them sustain healthy behaviors. And so at the end of the day, you'd want to think about creating baselines along a variety of different biometrics. And that's where it becomes very interesting for healthcare systems, because they're now in as they are shifting into value-based care and concern for population health. There's an argument, and there are some limited cases where health clubs are partnering with health clubs to deliver the kind of services that really healthcare companies or healthcare providers are just not capable of doing. My argument then is simply that you're in a really enviable position to be able to deliver value to the healthcare industry by pursuing an mHealth strategy that's integrating personal health data and making it actionable for your programming, but in the end delivering tangible, objectively measurable results like improved BMI, improved weight, blood pressure, or A1C, blood glucose levels. This particular slide is kind of my manifesto for you to consider if you were in the least bit interested in pursuing that kind of alignment with healthcare providers. And it starts again with the fact that your staff is in a much better position to devise and execute non-clinical consumer-directed programming than physicians ever will or care to be. And you also are experts in the consumer marketing. I'll go through a couple of other slides why these other points for defining your mobile health strategy are important, and also explain from a more macro perspective why it's important to consider creating value with healthcare providers by focusing on members with one or more chronic conditions, and then why it's important to come up with those objective health indicators. So the first point I'd like to make is really about the scale of mobile health apps in the market. In September, a report came out that showed that there were over 165,000 mobile health apps on the Apple Store and the Google Play Store alone, and the number on the App Store more than doubled from 2013 to 2015. Meanwhile, we're seeing 76 million smartwatches and activity trackers shipped through year-end. And I'm not going to get into some of the detail about why those things are great for Christmas and then they fall away 2 months later. In many respects, the question and challenge I put forward to those on the call is, what can you do through programming to actually extend that engagement and optimize the information that you can get from those kind of trackers? but again, returning to the mobile health apps that are available today, the gross majority are related to fitness, lifestyle, and diet. And to a very limited extent are there mobile health apps that are connecting to healthcare providers. And I think that that's a sign of the relative immaturity of the market and probably an unwillingness of or just an uncertainty by healthcare providers of what are they going to do with this information, to say nothing of it not being core to their core capabilities. But this is a very reputable, objective researcher, IMS Institute, and in their survey of the mobile health apps, they found that most of the apps really have limited functionality, mostly education. Only 10% actually connect with a device or a sensor, but a large portion, 65% of them, connect to social media, which signals an important trend to consider as you develop your mobile health strategy. A month ago, I guess 2 weeks ago, I came across this article that was in the MIT Technology Review, which I thought was kind of funny. Its title was, "Your Doctor Doesn't Want to Hear About Your Tracking Data." And I think this makes intuitive sense, but I think it's also informative that clinical researchers at University of California, San Francisco, and certainly others are really trying to derive value from these consumer wearables. There's a pony in here, is I think what they're trying to say, that there is, even if we can't come up with clinically relevant information yet, we'd like to figure out how to do it. But right now, clinicians can't do a lot with the number of steps you've taken in a day. My question to you is, can you, as part of providing support and encouragement and programming for people that are trying to achieve their health goals in your clubs? And this slide is really about a trend that we're starting to observe, and it's backed up by a lot of venture money that has gone into the companies that are listed here. While doctors may not want to look at the personal health data themselves, they're more than happy to have others look at it if what they can deliver are results. And to take one example, Omada Health is it's a weight loss program. It's 16 weeks. It's been clinically validated. An individual who's participating in the plan receives a wireless scale, and then they have a mobile app which allows them to receive encouragement, support, and access, connectivity, if you will, to a dedicated non-clinical coach. And not only has this been proven effective, but it's been adopted by such large health systems as Providence Health in Seattle and Humana, and both of those healthcare systems are investors in Omada as well. Similarly, a company called Curbo Health developed and really kind of mapped an already established clinically validated program to help overcome pediatric obesity and put it into a mobile app format. And they actually, back in September, announced a partnership with Humana. So if you can imagine Humana, one of the largest health plans in the country, having a call center filled with coaches that are now going to be working off of a Curbo Health platform in order to deliver this kind of coaching to help stem obesity remotely. My query to you is, can you do it better? Can you do it better for the people who live, work, and play near you, or play in your club and work and live near you? Providing a personal connection is a really important aspect of delivering mobile health solutions now. There's an increasing recognition as these four solutions show that it's not just the technology, but it's technology-enabled services, and in particular non-clinical services that can yield value to the healthcare system. So the other two examples include Chronotherapeutics, which has basically put a wearable patch along with a companion app and dedicated coaching to support tobacco cessation, and then an emerging company called Lantern Health, which is really there to provide asynchronous coaching via text messaging to help millennials or others basically navigate life's life stressors as you go through life. So to pause for a minute, I guess my thought is hopefully in your in the question portion, whether whether any of this resonates for you in terms of the kind of programming you think you could deliver, and whether an enterprise model along the line, that supports programs like this, but using your staff and accentuating your brand would be something that would meet your business objectives of acquiring and retaining members. And then if you're also able to deliver results, from these 4 companies that health systems are willing to pay for that value. This slide is interesting, or the information on it is interesting, because while doctors don't want to look at your steps, the healthcare industry or researchers remain hopeful that personal health data from consumer devices will indeed eventually yield clinically relevant data. So the fact that Azumio agreed to contribute de-identified anonymized data of 5 million users to Stanford computer research scientists in order to just play with the data, form hypotheses, see what insights they can yield, combining it with geographic data and social media usage, can be incredibly fruitful in terms of, I would say, in the first instance, making consumer-generated health data, I guess, valid to healthcare providers, but at scale become significantly more, just a more valuable piece than using medical grade devices alone. The other interesting development is coming out of Scripps Translational Science Institute in La Jolla. Scripps has really been at the forefront of wearable devices, and their latest is through a company they've incubated called IRhythm. What I find really interesting is that Scripps has partnered with Aetna and Johnson & Johnson to support a novel clinical trial. The first goal of using this wearable patch, the Zeo patch, is that it's a medical grade device, and if someone is going to wear it, the researchers want to see if they can actually have continuous monitoring using the device, improve the detection of atrial fibrillation when you compare it to the usual standard of care, which is a regular office visit. At the same time, these industry players are supporting a sub-study, which is basically to see if the heart rate and rhythm characteristics that are obtained from an Amigo wrist monitor, also from the San Diego area, can improve detection of atrial fibrillation. And a reason why the pharmaceuticals and the health payers would be interested in this, of course, is that the cost point, the price point for actually obtaining that information falls dramatically when you can get it at scale from consumer-grade wearable devices. I mentioned the economic burdens of lifestyle-induced diseases, and for your background, I thought it would be useful to see the scope of these obesity rates and what some influential researchers have said about what we need to be doing with it. First of all, 109 million Americans have at least one chronic disease, which can include cancer, hypertension, heart disease, diabetes, 2 others that I can't remember offhand. And they've done a calculation estimating the overall economic burden in terms of medical treatment and lost productivity at $1.3 trillion. And the Milken Institute estimates that through modest improvements in prevention and treatment, again, an area of focus, of emerging focus for healthcare providers, could yield a 25% savings, $220 billion savings by 2023. So my question again to you is, do you think you could obtain modest improvements in prevention and treatment through programming that you develop in your club? At the same time, the Milken Institute has first came out with recommendations before health reform, and then they reinforced them again a year ago by saying that the healthcare system has to create incentives for prevention. In other words, those incentives can be through benefits that they are offering through financial or otherwise. And I would surmise also potential alignments with health clubs, which is potentially a more attractive and appealing place in which to support behavioral change as a patient than in a clinical setting. And also, I thought it was instructive that of all the different ills that are hitting our population, that if we could renew our commitment to a healthy body weight, again, something that's intrinsic to the proposition of health clubs, then we would be well on our way to achieving those modest improvements and financial savings. What I would like to do, though, is also avoid a reboot of traditional corporate wellness programs. The RAND Corporation spent many years studying traditional corporate wellness programs, both the lifestyle management programs that many of you may be familiar with, like tobacco cessation, promoting good exercise, having and the like, versus very more clinically oriented disease management programs for people with manifest disease. And over many years, and after working very closely, especially with Pepsi Cola, RAND found that there was a negative ROI to the lifestyle management programs and a positive ROI with the disease management programs. I would simply say that one of the issues traditionally in the corporate wellness programs is that there was never any kind of accountability. So when earlier I was speaking to the need to use personal health data in ways that are actionable for you in terms of supporting your programs and supporting your members, at the end of the day, you would need to be accountable with objectively obtained quantifiable measurements of achievement. And I would suggest that those would be things like BMI and weight and blood pressure and A1Cs. So I would guess that some of you on the call would say, yeah, right, when would a healthcare provider ever want to partner with us? And so I thought it would be instructive to provide you with an overview of the landscape, the value landscape in healthcare. This may not be, since you'll be getting a copy of this later, it's a fairly lengthy number of slides. I just want to commend it to you for future reference when it's relevant to you, and certainly you can call me as well when it's relevant. But generally, the landscape of value for healthcare is defined by this triple aim, aiming to achieve better health outcomes, have the healthcare system deliver better care, and overall reduce lower costs. Since many of you know, about 18% of our GDP is due to medical spending, that's unsustainable, and we just overall have to reduce those costs. And so that's how those three aims are tied together. Under the health reform, there are a variety of different programs, some of which I'll walk through with you, but they're all designed at changing the focus from volume to value, so that whereas in the past payment has always been linked to the volume of care, payment instead will be linked to a healthcare provider's performance. Likewise, instead of paying for interventions that address medical needs, the system is orienting itself, and through the public and the private payers are looking more towards outcomes and penalizing healthcare providers for poor outcomes. So there are all these other kind of constraints. I'm going to focus on the value side, where this drive towards value is causing a variety of different activities to be taken place, where cost structures are being improved, almost looking at the industrialization of healthcare, and all the while looking at ways to come up with the best care at the least cost. In terms of wondering how soon this will happen, sounds great in concept, but when will it really happen? Last year, January of 2015, beginning of this year, HHS announced that they were going to be moving aggressively through the Medicare program from volume to value. In fact, it's going to be something like, I've got a slide in here later, that about 65% of all of the Medicare contracts will be tied to value by the end of 2016, and 85% by the end of 2018. So it really is something that is a matter of urgency for the healthcare providers. what the value-based models look like is really one that's sequential, and in terms of you needing to take baby steps in order to achieve what could ultimately be a full risk capitated arrangement where a single budget is given to a healthcare provider, and then they're responsible for figuring out how to allocate that budget to deliver the best care at the least cost to an attributed population. But before getting there, there are a variety of other different models that have been used to varying degrees. And so I just wanted you to see the variety of them. I'm going to walk through a number of these in the next slides. So the first I'll focus on are episode-based bundled payments. And some of you may be familiar with these if you have physical therapists on staff or physical therapist practice nearby. The idea is that when someone is having a joint replacement, for example, instead of Medicare, instead of paying for each incremental service, is now going to pay the hospital a single bundled payment, and now make the hospital responsible for distributing those funds in ways that are that will discourage the person from coming back in to, in other words, preventing otherwise unnecessary readmissions, and also delivering good care. In my practice, I'm aware of quite a number of mobile apps that are being directed at healthcare systems in order to achieve a lot of this post-acute measures of achievement, but it's arguably something that you can consider as well if you were to move upstream into the kind of services you are willing to provide through your club. Shared savings is another payment strategy that providers are developing, and it's a concept in which they're working with payers to work collectively to reduce overall costs. And if there are savings, then the providers get to receive a percentage of the savings realized. There's also, with added sophistication and a willingness by providers to do so, to also take on shared risk. And that's ultimately what's going to happen to an increasing degree as we move towards something approaching capitated payments. But we're seeing a lot of those shared savings and shared risk programs emerge through the Medicaid programs. Medicaid happens to be the largest single payer in the entire country. And so when it makes these programs, they're not just simply saying this is the amount. They're usually also coupling it through a variety of different waiver programs of delivering some non-dilutive capital to healthcare providers to actually fundamentally reform their delivery systems so that they can be more efficient. But the bottom line at the end of the day, once those programs have been established, is that the healthcare providers will be ultimately accountable, and at a financial level, and they have to figure out how to work that out. That's actually the key part of what Manette does with our healthcare providers. So I mentioned global capitation earlier on, so I'm not going to dwell on this, and I want to be sure I come in under an hour with our presentation. So I will move on. Payer progress towards value. Again, I mentioned where the how quickly is this going to emerge. The numbers are actually 85% of Medicare payments by the end of 2016 could be based on value, tied to value, and as much as 90% by 2018. So stepping back and thinking about your role in the community vis-a-vis the healthcare providers who are seeing your members, you now know that they're seriously looking at ways of finding the most value to achieve health objectives, and they're going to have to look at things that are not requiring medical treatment. To the extent that you can avoid medical treatment or clinical options, so much the better. And I'd like to submit that you all are in a better position to do that, and may be better equipped to do so in an engaging non-clinical way through your sophistication with media and engagement. So I'm going to bump ahead here and bump ahead here. I mean, this is another program that came following health reform. Its shorthand is MACRA, but where healthcare providers in the health systems have been bearing a significant amount of activity for driving towards value. When Congress eliminated the doc fix back in April, they put in place more of a value-based reimbursement model for physicians. And so now physicians in the community, those who are not employed by health systems, are now going to have to be at risk for if their attributed populations are not meeting certain quality metrics, or it will alternatively drive these physicians into accountable arrangements with other healthcare providers, including health systems. The private market has been very active in creating accountable care organizations as well, and we've talked about a couple of different models. This chart shows how many. I'm actually rather surprised that 15% of the private ACOs are full capitation. It would be interesting in your respective markets to find out from your health system partners what kind of programs they are in that are value-based, and whether they are public programs with Medicare and Medicaid versus those that are with commercial payers. And once you do that, you find out what where you're basically looking for alignment of needs of how they need, identifying populations that you think you could help and achieve certain goals at less cost. So this is my slide summarizing all of this. As healthcare providers assume more financial risk for the health of a given population, they are open to strategies that improve prevention, reduce medical spend, and help them acquire more plan members. Acquiring more plan members is a really important piece here too, because I think of it in terms of the premium that healthcare providers are now assuming in partnership with payers. So a premium is a full dollar. Anything that they don't use for the medical spend is margin, and they're looking to increase as much margin as possible. They also need to cover a lot of their overhead, and so they need as many members as possible. And if they can get more healthier members, then their margin is going to be improved. And so again, that's another way of thinking in terms of how you can propose your value to healthcare systems if you're at all interested in a partnership with them. Now, I mentioned earlier this slide, the doctor doesn't want to see your tracking data. There are a lot of other reasons why they don't want to see personal health data. Personal health data, to show you in this slide, is governed by the FTC and Fair Business Practices, and it's generally not protected health information, which is subject to significantly higher penalties for breach, and also more elaborate controls to protect that information. So if they can create a partnership with you and basically have a firewall that prevents them from accessing user-generated health data, then it shifts the burdens to you to make that data actionable, and it reduces the burden for the healthcare providers to figure out its clinical relevance, and at the same time alleviate responsibilities for securing the data and making it accessible to the patients who request it, which is also an important aspect of HIPAA, providing a wide variety of individuals' rights to access the data, restrict the use of the data, and the like. Also, frankly, given the nature of our litigious society, if the user-generated health information is not in the provider's data warehouse, then by having that firewall in place, you eliminate the risk that a plaintiff can contend that the healthcare provider committed an injury and that could have been avoided if they'd only looked at that user-generated health data. So again, siloing it and making it actionable outside of the healthcare complex is itself a value to healthcare providers. I assume that many of you already have some privacy and data security practices, If you don't, you should. They are, the FTC is an active enforcer of privacy and data security practices. Some of the kind of requirements that they expect all industries across all verticals to have are listed on this and the next slide. They include establishing and maintaining a comprehensive information security program with administrative, technical, and physical safeguards, designating an employee to coordinate and be accountable for that program, identifying, going through an assessment process, and this is not unlike a process that you do with PCI, identifying threats to the security, confidentiality, and integrity of the data that could result from unauthorized disclosure, misuse, or loss, and also assessing the sufficiency of your safeguards, such as reviewing your employee training and management, your information systems, and the strategies for preventing, detecting, and responding to potential attacks or intrusions or other failures. And then, after completing that assessment, designing and implementing and testing reasonable safeguards to control for risk. Okay, I guess that was just one slide. I thought I had two, but it may well come up. So let me walk through a scenario where what would happen for you if you were to become in possession of protected health information. That can occur, for example, if personal health, if you breach that firewall and you transmit personal health data to the healthcare provider. The HIPAA statute is really is purposely vague about what is protected health data. It only says what it is not, and basically what it is not is essentially de-identified, anonymized data. So any of this information, even from consumer wearables, can be deemed or would be deemed protected health information if a health club were to transfer it over. And when that happens, then you are subject to significantly more restrictive privacy, data security, breach notification, and enforcement rules. Whether you sign a contract or not, you become what's known as a business associate, which means that you have to adhere to the same administrative, physical, and technical safeguards as a covered entity under HIPAA. And if you don't, then you would be directly liable for civil money penalties. And at the same time, you would be responsible for adhering to the HIPAA individual rights, which require you to take steps to accommodate requests by an individual to restrict the use of the data, make the data available to the individual, and also provide an accounting. My contention is that there may be some information like BMI or other weight when you're getting to delivering objective, quantifiable measures in order to demonstrate value, so that you can receive some kind of a value-based payment by partnering with a healthcare company, but do so in a way that is carefully structured and that is not where you're not unwittingly creating a situation where you're becoming a business associate without realizing it. There are also two other points here which is really important. Personally identifiable data under HIPAA is strictly prohibited from being used for marketing without the individual's express written commitment authorization, and that is a significant difference from the disclosure rules that are otherwise part of the FTC regime. So that would be another potentially breachable offense if you were to unwittingly become a business associate and then use personal health data for marketing purposes. So my final cautions to you then is if you see a value proposition for using personal health data and leveraging your comparative advantage of using social media and other tools to drive very positive health results, you still would need to do so in a carefully structured manner. Some of the things that you would want to make sure are done properly is a thorough review of the privacy policies, the terms of use, and data security procedures for the mobile apps and wearables that you would bring into your strategy. Before exchanging any personal health data with healthcare providers, looking into what exactly you're doing and what kind of controls you would need to put in place, or potentially have third parties be the intermediary for receiving that data with the members' consent. Ways, in other words, to limit your exposure as a business associate subject to HIPAA. And then, of course, this is an area that's very new. Coming up with the metrics, coming up with the value of payment, essentially figuring out what a performance-based contract would look like is still a very new concept, and that would be something you'd want to be looking at very carefully, and have those values be validated as part of developing your mHealth strategy, so that you can see whether it's not just a strategy for member acquisition, retention, and brand, strengthening your brand, but is also feasible for delivering alternative revenues from healthcare networks. Finally, of course, you would in all cases want to have your member consent policies reviewed when you're using personal health data, and especially if you are sharing it with others, and then also making sure that your privacy and data security policies are up to date. For those who are really interested in understanding the larger view of healthcare, it turns out that tomorrow some of my colleagues will be giving a webinar about the shifting healthcare landscape more broadly, in a webinar titled "The Megatrends Reshaping Healthcare, Managing Change and Maximizing Opportunity." It's sponsored by Bloomberg BNA, and it's free of charge, and I welcome you to join it if you are so inclined. So I am done, and I'll turn it over to Todd to see if there are any questions.
Awesome. Thanks, Jill. Attendees, this is your chance to pose your questions to Jill concerning personal health data. I'll give you a second to submit your question so that Jill can respond. And in the meantime, Jill, let me go back to that notion of triple aim. And as we think about value in the health and fitness industry, I'm curious, in terms of growth, I mean, certainly the opportunity for a health savings account to include a reimbursement for gym memberships. Where are we with that, kind of within the payer provider space, and maybe where are things going to be going in the next few years?
Well, the idea of reimbursing for gym memberships is sort of challenged at this point. It sort of falls into the category of a conventional corporate wellness program, where the people that are going to take advantage of those kind of discounts are those most likely to go to a gym. And what we're really talking about to make a compelling argument to healthcare providers is getting the next level of people who have one or more chronic conditions, who really, with are in need of having a much more coachable. They need to actually turn the dial on their healthcare, and they may not have the lifestyle skills or behaviors that will allow them to get healthy without a bunch of help. So it's really about making an argument about the kind of program that you can deliver, and that it's acceptable to members, and that you're actually achieving results. That's really going to be the driver here, as opposed to simply giving discounts. It could well be, however, that this is working in a twofold capacity, where if where a provider, or really the payer, offers discounts on a deductible, for example, by virtue of a participation in a program like this. So while the result isn't guaranteed, participating in a more structured program is itself maybe sufficient to give people the impetus to join the club and participate in the program. Does that make sense?
It does. Thank you. Attendees, again, your opportunity to pose your questions to Jill. Please use the question interface inside of the control panel. Jill, I'm curious, how do you view, or how would you kind of evaluate how the fitness industry is doing in terms of lobbying Congress to move forward with incorporating fitness into this larger conversation about convergence?
Well, I'm not a government relations person, but there's very little appetite to bring any further legislation relating to health reform forward. I can't remember the number, but hundreds of bills have been put forward to eliminate it in total. So the idea of tweaking it around the edges and bringing in potentially, uh, more cost into the system by paying, that's unaccountable cost, would be very challenging at this point. The analogy I bring is one portion of Affordable Care Act included a charge to the Health and Human Services to develop a long-term care insurance plan, and it basically could not pay for itself, and so it was shelved. In other words, there has to be a real economic argument, a compelling one, to have anything move forward in Congress.
Again, attendees, this is your chance to pose questions to Jill. Jill, I'm curious in terms of your recommendations for a fitness facility. Where do we start? I mean, certainly with privacy policies, where do they need to be posted? Can you give us a framework?
Well, I tend to think that platforms like Apple HealthKit are influencing the market in a direction towards informed contextual consent. And especially at a time when you are bringing in new members and you are trying to create a holistic experience where they can see all of their data in one place and then give them some controls over it, that's the appropriate platform, the mobile device, to obtain the consent, and doing it contextually as each new feature or integrated app comes online is an appropriate way to do it. The idea of just having a link to a privacy policy or in terms of use as a link at the bottom of a screen is increasingly falling out of favor. That's not to say that a lot of people will just make a calculation that they like the app and they like the convenience and they just want to move on. But there are definitely ways in which mobile app developers can distinguish themselves by providing a compelling experience that also provides an informed consent that is not that doesn't slow down adoption. Once you also get into the matter of sharing data with healthcare providers, that's where you need to be really taking a very strong position. I would actually not rely simply on a consent through a mobile app, but it would be through sort of the mechanism of the program that you develop within your club. These dedicated staff, and they're doing things in a somewhat more isolated fashion and getting a wet signature. While wet signature isn't required under HIPAA, we're at a pretty early stage. This is pretty new, so you want to make sure that people know exactly what you're doing.
Gotcha. Attendees, final chance here to ask questions for Jill. Jill, while we're waiting for some attendees to pose their questions, maybe some final thoughts here and key takeaways for our audience today.
Well, I mean, I would go back to thinking, my most important thought here is that if you're listening to this program, you're trying to think about what to do with personal data and how you can best monetize it. And there was an earlier slide which was basically going through a thought experiment where you first think about a mode of engagement, and then if you just think about how you can expand upon it to create an enterprise platform using that music streaming with playlists that can be shared as an example, then you can start using, you find out other different compelling features in media and maybe go through that same kind of thought process and basically through accretion develop a cohesive mHealth strategy. But then as you do so, keep in mind that it's not simply a matter of trying to strengthen your brand and increase membership and retention, but it's an opportunity also to capture quantifiable data to demonstrate outcomes so that you can see if there's an argument for aligning with the healthcare providers in your community as value-based care matures.
Awesome. Well, Jill, thank you so much for your time today and taking a few moments here to walk us through personal health data. Attendees, our last session in the Motionsoft Technology Summit Education Series will take place this Thursday at 2 p.m. with Bill Besselman, VP of Integration and Digital Strategies at Under Armour Connected Fitness. You can sign up for the session by visiting the MotionssoftTechnologySummit.com website. This will conclude our webinar for today. Thank you.
Thank you.